Hello, my name is Richard Iliff. I'm from the Gold Standard. Welcome to this fourth and final training module as part of our series of tutorials on the methodology to estimate and verify ADALYs from cleaner household air. This training module will provide an introduction into HAPIT, the household air pollution intervention tool that is required to be used in the methodology to calculate ADALYs. And the second tool that's covered in this module is a guide on how to use the Cookstove impact quantification tool, a web-based application that is available for project developers to monitor and report on their improved Cookstove projects. HAPIT, the household air pollution intervention tool. It's an easy to use tool designed to estimate the health benefits of household energy interventions. And it's a requirement that project developers using the ADALYs methodology must use HAPIT to convert PM2.5 exposure reductions into ADALYs. HAPIT estimates the disease burden attributable to the change in exposures before and after a project is implemented. It does this by comparing the health impacts as a result of exposure to fine particulate matter, or PM2.5. HAPIT does not currently estimate changes in health due to changes in community or regional changes in air pollution from household interventions that would not be captured by normal household exposure measurements. The object of HAPIT for clean cooking project developers is twofold: to help them design better interventions and to potentially help raise funds to implement dissemination projects through results-based financing. HAPIT currently contains background data necessary to conduct analysis in 104 countries and at a subnational level in 31 provinces of China and 21 states of Mexico. It was developed by researchers at Household Energy, Climate and Health Research Group at the University of California, Berkeley, and is available free to cost for the user at the link available on the screen. So how does HAPIT work? This slide gives an idea of the complexity and variety of data sources used to develop HAPIT. HAPIT relies on the following data: country-level data on methods and databases developed as part of the comparative risk assessment, which is a component of the Global Burden of Disease effort at the Institute for Health Metrics and Evaluation, IHME. It includes exposure response information for each of the 5 major disease categories: acute lower respiratory infection, chronic obstructive pulmonary disease, ischemic heart disease, stroke and lung cancer, that are all attributable to fine particulate matter personal exposure, including those from household air pollution. It also includes background health, demographic, energy and economic conditions from IHME. It estimates averted deaths and disability adjusted life years, DALYs, from user-specified baseline and project PM2.5 exposures. And it does this by referring to epidemiologically derived integrated exposure response functions. HAPIT estimates the disease burden attributable to the change in PM2.5 exposure before and after a project is implemented. The pre-intervention burden of disease is subtracted from the post-intervention burden to estimate the burden averted by the project. The outputs take the form of a number of reports and include avoided deaths and DALYs attributable to the proposed interventions by disease category. The specific methodology underlying HAPIT are fully detailed in the Gold Standard ADALYs methodology, which is available online, and in a prior publication about HAPIT tool. In previous modules, we discussed the monitoring requirements of the ADALYs methodology. Various monitoring helps collect the information required for HAPIT for the ADALYs estimation. As a reminder, this table has a summary of the key input parameters for HAPIT with the relevant monitoring study on the table on screen. So for instance, you can see number 2, baseline PM2.5 exposure is conducted one time, and the monitoring method is the baseline personal exposure monitoring. For example, number 8, fraction of targeted households using the intervention, which is known as the usage rate, is conducted annually, and the source or monitoring method is usage survey or CSMs, continuous stove monitors. As you can see from the screen, HAPIT's available at the link. It uses consistent colour schemes throughout its implementation to indicate areas where user inputs are required. These are in red, and areas with background information or non-changeable parameters. These are in blue. HAPIT's homepage includes a navigation panel on the left-hand side of the screen, an introduction, and background information on the selected country. As you can see from the screen, you can select the country using a drop-down interface. Users can either scroll through the menu to identify their country of interest or start typing the country's name, filtering options based on the user input. For a selected country, the background information will appear at the bottom of the screen in the two tables, one of which shows socio-economic and demographic statistics. In the example on the screen, we have Nepal, so the population is 27.8 million. And the other table shows the annual disease data. And again, the example is for Nepal. After selecting a country, users click the Inputs tab under the Navigation section to enter exposure and intervention-related parameters. When running HAPIT in the context of the ADALYs methodology, certain things need to be borne in mind. The project developer needs to use HAPIT to estimate ADALYs for the individual scenarios identified in the project area. And various default figures should be used. These will be described later on in this tutorial. On the HAPIT input page, it provides the instructions and 3 sections whereby the relevant information to estimate ADALYs shall be inputted. The first is the population inputs on the top right-hand corner of your screen. The second is the intervention inputs on the bottom right-hand corner of your screen. The third is exposure-related inputs on the top left-hand corner of your screen. HAPIT provides the default values which shall be modified based on the project or project scenario specific inputs. The population inputs has 3 areas. The number of targeted households. In the ADALYs methodology, the user shall provide the number of households targeted for the stove distribution in the project or in the relevant project scenario if there are multiple scenarios in the project. The people per household. The user shall input the family size based on the baseline survey results for ex ante information and also using the project survey results for ex post estimation, which is the scenario after the project during monitoring. The kids less than 5 per household. Again, the same source is used for the people per household. So depending on whether it's ex ante, the baseline survey, or ex post, which is the project survey. The adults per household value is calculated automatically in HAPIT by subtracting the number of children per household from the number of people per household value on screen. The intervention inputs has 2 inputs. Number 1, the percentage using the intervention. This is the usage rate that corresponds to the number of households who use the project technology. For the ADALYs methodology, the user shall provide the expected user rate for ex ante estimation, whilst for ex post estimation, the usage rate derived from annual usage surveys or the continuous stove monitor study shall be applied. The intervention useful lifetime. HAPIT defaults to setting the useful lifetime of an intervention as 1 year. This value should not be changed when applying for certified ADALYs for gold standard methodology, so it must remain as 1. The final set of inputs are the primary cooks average pre- and post-intervention PM2.5 exposures under the exposure-related inputs field. The primary cook mean pre-intervention PM2.5 exposure. The user shall input the baseline personal exposure monitoring value after a 90-30 statistical assessment has been conducted. The primary cook mean post-intervention PM2.5 exposure. The user shall apply the project PM value after the 90-30 statistical assessment has been conducted for this field. The standard deviations. The user shall use the corresponding standard deviation for both the baseline and monitoring values, and it shall be used based on the measured values from the studies conducted. They're automatically calculated when you use the 90-30 assessment tool available with the methodology. Alternatively, the user may select the default value option provided in HAPIT. However, this does need to be justified during project certification. The mother, child, and cook other adult exposure ratios adjusts exposures for other household members based on measurements from the scientific literature. Currently, HAPIT uses default adjustment factors for other household members of 0.6 for non-cook adults and 0.85 for children, following the methods used to calculate impacts in the IHME Global Burden of Disease project. These values shouldn't be changed when applying the ADALYs methodology. They must remain at the default. After entering the exposure inputs, click Update Exposures tab near the bottom left-hand corner of your screen, and then navigate to the Health Impacts panel using the navigation sidebar. Running HAPIT can take between 10 seconds and 1 minute depending on the server load. There are a lot of complex calculations that need to take place. A progress bar indicates whether the run has completed or not. Once the run has completed, plots of averted ADALYs and deaths are displayed by disease type. The tables of averted ill health, both in total for adult and child outcomes and separately for each disease by deaths and ADALYs, are displayed. For ADALYs methodology, the user shall use the sum of mean averted values under the summary table for GS certification, taking care to add the child to the adult values. Click on option Deaths and ADALYs and use the sum of both for the disease-wise ADALYs. Finally, by clicking Downloads from the sidebar, HAPIT output can be downloaded either in the form of a standardized, well-formatted report, as can be seen on screen, and the user shall download this report and provide a copy during the certification review. The option to download the HAPIT output is in the form of separate tables by clicking on the Download Archive. The archive contains 7 items. The first, exposure distributions. This is pre- and post-intervention PM2.5 exposures based on the user input. The averted ill health plot. This is the high-quality PDF version of the plot displayed on the Health Impacts panel. BGDD burden. The background burden of disease from GBD 2013, the global burden of disease. Averted ill health plot. This is the avoided and avoidable by the best possible intervention bar chart by the end point. The BGD burden CSV. This is the background disease information from IHME. Averted by cause. This is the averted deaths, ADALYs, YLLs, YLDs by disease category, presented as minimum, maximum, and means. The scenario details. This details the user inputs and selections. And the total averted is the mean, minimum, max for child and adult separately. The BGD SES demographics. This is the relevant background characteristics for the country or subnational region of interest. The user may also download the archive for certification purposes. As mentioned earlier, HAPIT is a general purpose tool. For application in the context of the gold standard ADALYs methodology, the HAPIT output needs to be adjusted based on the specific project implementation details. In terms of the health benefit accounting, ADALYs and avoided mortality will be awarded to projects each year of the project's lifetime using the monitored exposures and usage rates as per the monitoring requirements. The long-term health benefits associated with each year's exposure reduction are included in the annual estimates from HAPIT. These benefits would be expected regardless of whether exposure levels return to the baseline in the next year. But for conservativeness, HAPIT will calculate health benefits for only the 5 years following a 1-year exposure reduction. This represents 80% of the total health benefits that would be expected over the 20 years following the 1-year exposure reduction. HAPIT, it's a tool in flux and it will be updated regularly as per the global burden of disease as and when that is updated to incorporate new evidence on health effects as it becomes available and as population demographics change in consultation with the Gold Standard Technical Governance Committee. These changes may increase or decrease the ADALYs per unit reduction in PM 2.5. Project developers will be issued ADALYs that are estimated by the version of HAPIT in use at the time of requesting issuance of ADALYs certificates. As HAPIT runs in full calendar year increments, thus the output of HAPIT needs to be multiplied by the weighted average fraction of days of the year during which the project technologies were operational. HAPIT uses a variety of input parameters to estimate averted deaths and ADALYs. Parameters that are hardwired into HAPIT and cannot be altered by the project developer include the exposure results functions, population, and baseline disease incidence rates. HAPIT assumes that all the users provided with the project stove use polluting fuels. As discussed during an earlier module, the project developer shall carry out the project household surveys to capture any change in cooking pattern. The surveys provide the number of households that are using polluting fuels year after year. HAPIT output shall further be multiplied with the fraction of the project population using polluting fuels in the relevant project scenario. These polluting fuels include biomass, which comprises wood, dung, crop residues and charcoal, coal, including coal dust and lignite, and kerosene. The second part of this module is dedicated to explaining how the gold standard impact quantification tool works. It's a tool that's integrated to help gold standard Cookstove project developers develop and manage their projects starting from conceptualization right up to the issuance of certified impacts like emission reductions and, for the context of this presentation, ADALYs. Using a gold standard approved methodology and other ways of assessing contributions to SDGs, the tool is able to provide an output in a specified form that can be used for certification. As discussed, the focus now is on the ADALYs component of the Cookstove IQ. A detailed downloadable manual is available in English and Spanish on the tool, and this will be discussed during the later slides. In general, the tool is self-explanatory. It's been designed to be easy to use, and it provides the guidance on the required information for each step. The first page provides a quick overview of all projects held within the Cookstove IQ account. And each project exists in only one IQ account held by a project owner. There are two types of menu bar. The top menu bar, running along the top of your screen. shown in red. It includes general functions available, such as the user manual, available in English and Spanish, a cost-benefit analysis tool, or CBA tool for short. This is currently developed only for the emission reduction component, but later work will incorporate ADALYs. There's a feedback section that users can provide any information on bugs or suggested improvements. And there's the projects tab, which means the user can access the first page of the tool at any time. From this page, a user can add a new project or enter an already added project by clicking on the blue links on screen, and then view, edit, enter or edit saved information about the project. This summary page also provides key high-level information about the project, including the title, methodology and status. For instance, new, certified design, certified issued, etc. The second type of menu bar, shown in red, includes tabs to add or view project-specific information. The left-hand menus are placed from top to bottom to generally approximate the order in which they should be used during the gold standard project certification cycle. The menus down to estimated ADALYs, which is the fifth menu down, mark the steps involved in achieving project design certification, or in other words, the ex-ante estimation of emissions or ADALY certificates. The Stove database surveys and tools and monitoring are required for the ex-post or monitoring part of an emission reduction or ADALYs project. The Sustainable Development Assessment incorporates both ex-ante, pre-project, and ex-post assessment monitoring in the same menu. On the project summary page, the user provides the project information and then moves on to stove detail, and so on and so forth. The calculations that IQ performs relies on information that is gradually inputted by the user, and so in some cases information in one menu must be complete before another following menu can be used. There are a number of tooltips that provide specific guidance on how to enter information into this section and all others throughout the tool. A tooltip is indicated by a symbol that looks very much like a question mark. So on screen it's highlighted with a red question mark. There's a smaller one in white. In order to view a tooltip, simply hover over the white question mark symbol and some explanatory text will appear. IQ provides the option to use the ADALYs methodology alone or in concert with an emission reduction methodology, for example, technologies and practices to displace decentralized thermal energy consumption. When two methodologies are selected, the information entered for one methodology will be available for the other methodology, and vice versa. A user can select the ADALYs methodology from the drop-down list for a health impact methodology. The Stove Details menu is split into two submenus, the first of which is Baseline Stove, which houses information about the stove replaced by the project, and Project Stoves, which houses information about the stoves that will be distributed in the project to replace baseline stoves. The Stove Detail menu is the first place where data that you input into IQ will be stored and used in calculations. Therefore, you need to take extra care to ensure that the data you input is accurate. By clicking on Add Baseline Stove, the blue button, you should enter data for each different baseline stove model or name that will be displaced by the project to generate ADALYs. If you already have data and you wish to update it, simply click the Edit button. This same pattern is followed throughout the tool and so should become familiar. The Project Stoves menu is structured in the same way as the Baseline Stoves menu, with the first screen showing a table that summarizes the key detail about the types of project stoves that have already been entered and saved. You should enter data for each different project stove model that will be distributed in the project. You can edit the information in the similar way as you can for the baseline stove. A tooltip on this page explains how the tool imports stove distribution information and assigns each project stove type with a unique GS stove code. This unique stove code allows each stove that is uploaded to the stove database to be linked with the information entered on the project stoves page. As such, you will need the stove code linked to your stove name to upload information onto the online stove database. The baseline information menu is structured in the same way as baseline stoves and project stoves, with the first screen showing a table that summarizes the key detail about the types of baseline information already entered. You should create a set of baseline information for each scenario that will be displaced in the project to generate ADALYs. The first step in building a set of baseline information is to map the relevant baseline stoves already entered in baseline stoves menu into the crediting baseline information. The same baseline stove may appear in any number of different baseline informations. If two or more baseline stoves are included into a baseline information, it is necessary to weight the relative percentage prevalence of each within the baseline information. An on-screen tooltip explains this in more detail. This section requires information for the individual baseline scenarios that exist in the project. The screen includes two specific scenario inputs: baseline survey information, which includes the key baseline information that should be sourced from baseline household surveys, and the baseline personal exposure details. This houses input fields to add information related to the baseline scenario, for example, the personal exposure monitoring approach, gravimetric or optical, and then customizes the follow-up fields. For example, if optical personal exposure monitoring is chosen for the baseline, it will require input values for an adjustment factor to correct it to gravimetric. It also includes an input field for family size and children aged below 5 years, matching that on HAPIT. In the document section, the user can upload the relevant documents and provide comments in the comments section below the document field. The project information menu is structured in the same way as baseline information menu, with a summary table with the key detail about information already saved. As project information menu involves the creation and mapping of project information to relevant baseline information, this landing page also summarizes which baseline and project information have been mapped. The project information menu requires information from baseline stoves, baseline information, and project stove. So it is essential that data entered in these menus before starting to map baseline and project information. In couple with all other menu screens in IQ, the screen requests only the information required to calculate the project ADALYs. For example, project survey information. This includes the key project information that should be sourced from project household surveys. The estimated ADALYs menu contains 3 submenus. Number 1, the stove rollout plan, HAPIT input, and a display of the estimated ADALYs. It is essential that the stove rollout plan and HAPIT input is completed before entering the estimated ADALYs submenu, as the calculations are based on the stove numbers indicated in the rollout plan submenu and HAPIT input. Stove rollout plan is used to provide information on the numbers of stoves targeted for each project information dataset, i.e. the mapped baseline and project information for each year of the project crediting period. The menu allows the user to define the project start date, which is the date of construction or real project action, and the crediting period start date, the date from which crediting begins, which, by the way, does not have to be the same as the project start date. And it also allows the length of the crediting period, the number of years the project will credit for, to be specified. The HAPIT input submenu is divided into 2 parts. The first is a HAPIT input table that mirrors the key information that is inputted into the HAPIT tool. The objective of this table is to help the user see all the information required for the HAPIT input. And the user can then click on the Go to HAPIT button in blue to reach the latest HAPIT page and input the information on screen for each scenario into the HAPIT input section. As discussed on previous pages, HAPIT input is further required to adjust for project level assessment. To process the information, the user shall input the mean and disease-wise ADALYs for each scenario, as can be seen in the red box. The third menu is the estimated ADALYs, which summarizes the ex-ante or estimated mean ADALYs and disease-wise ADALYs based on the data previously entered in baseline information, project information, stove rollout plan, and the HAPIT input. So it's essential that all this data is already entered before using this manual. The calculation formulae and the adjustments that are required to estimate the ADALYs have already been entered and stored in the tool itself. The ADALYs estimates assume that in years when stoves are distributed, they're distributed equally across the year, and they assume that 365 days operation in each year. Turning to the stove database. On IQ, the stove database is a central online repository that holds all of the records of stoves that are part of the project and contains their respective profiles as defined in the mapping, project information, and baseline menus. It is structured in a similar manner to other menus in that the first menu screen is a summary of all the inputted data. However, unlike other screens, there is a dedicated search function using the blue buttons to allow the user to access stove information quickly and easily. There are multiple ways of searching, including by specific stove ID, and there are also search filters, including date of sale and project information reference. The database can also be downloaded in Microsoft Excel at any point using the download button as shown in red on the screen in the top right corner. All stoves that are entered into the database must supply the minimum required information such as stove ID, date of sale, and name of user, as IQ performs a few validation checks to ensure that the data is of good quality. For example, checking that the date of sale is not before the current date, and checking that the date of sale also falls after the project start date. A user can access the stove data upload template and guideline documents simply by clicking on Add Stove Data. There is no limit to the number of stoves that can be added to the database at any given time, and we suggest that you add stoves in batches to use it efficiently. Though it is vital to ensure that stove records are completed correctly. As previously mentioned, the database will not accept the record as it conducts a few validation checks. In the Surveys and Tools menu, there is a set of methodology-specific survey templates, calculation sheets, and monitoring sample selections. It's split into two submenus, Surveys and Tools, which hosts all the survey templates and survey result assessment tools that are available to the user to help with the project development process. And the second submenu is sample generation. When conducting monitoring studies, it's a methodology requirement to conduct studies on stove users that have been chosen randomly to avoid a bias in the results. Studies are usually conducted separately for each project information reference or project scenario appearing in the stove database. The sample generation tool allows the user to quickly select the study or survey type and then to automatically generate the required number of random samples for each of the relevant project scenario types. A list of random samples can be downloaded from this menu to guide where individual studies need to take place. It has also been designed so that the random sample information can be easily copied across to any of the survey results analysis tools that are supplied in Surveys and Tools submenu. The monitoring menu is used to generate monitoring periods and report on the monitoring parameters required by the ADALYs methodology. It is dynamically linked to the stove database, which we covered earlier, and so it automatically displays the number of stoves that have been uploaded to the database. Monitoring ADALYs requires information from the stove database, baseline stoves, project stoves, baseline information, and project information menus. So it's essential that all data is entered in these menus before any calculations can be made. Following the usual pattern, the first screen that a user sees is a summary of any of the monitoring periods that have been previously saved. If no data has been entered, then this screen will appear blank. To generate a monitoring period, simply click on the Add ADALYs Monitoring Period button. The start date of a monitoring period is always fixed and will either be the start date of crediting, defined in Estimated ADALYs menu, or the day following the end of the previous monitoring period. The end date can be freely chosen by the user, up to a maximum number of 1 year after the start date. If your chosen monitoring period for an issuance request is longer than this, a separate IQ monitoring period will need to be inputted. The reason for this is that monitoring data is very commonly required on an annual basis, so for accuracy of data, IQ requires that data is inputted in annual periods. After adding the dates, click on the next tab to add monitoring information or parameters. Under monitoring, HAPIT input page is divided in two parts similar to the estimated ADALYs. The first is HAPIT input. This table summarizes the project-related information that has been added previously and provides a field to add monitoring data. The objective of this table is to collect all the information that a user will be required to run HAPIT to estimate ADALYs for the selected monitoring period. The user can click on the Go to HAPIT button in blue to reach the latest HAPIT page and input the information for each scenario into the HAPIT input section. As discussed earlier, HAPIT output does need to be adjusted for each project level assessment. To process the information, the user needs to input the mean and disease-wise ADALY for each scenario in the bottom table. That means that this information needs to be taken from HAPIT and inputted into the IQ tool. Finally, this screen presents the calculated ADALYs for each scenario as per the monitored information and the HAPIT output. So what IQ does is it refers dynamically to the stove database to count the number of stoves and the number of stove operational days between the specified dates of the monitoring period. So in the example on screen, between the 1st of January 2017 and the end of 2017, the database has recorded nearly 40,000 stove operational days. The calculations that are automated by IQ have determined that the ADALYs per household per day are set at 0.0130. So very simply, the sum of operational days and the number of ADALYs accrued per household per day are used to calculate the total number of certifiable ADALYs for each project information reference. This is a simple example with only one project information reference, which you can see on screen is called Inca 1. The final step in reporting ADALYs is to press the Submit button, which freezes all data for auditor and certifier review. And once the data is successful, it will be used to issue certificates according to the values calculated by EQ. You can see a second table on screen, which shows the concept of withholding ADALYs, which is something that has been explained in earlier tutorials. But to touch on it now, the number of issuable ADALYs in years when personal exposure monitoring is not conducted is capped at a maximum of 60%. This is to prevent the accidental overissuance of ADALY certificates in years when personal exposure monitoring has not been conducted. Thank you very much for listening to this final module in the training series to build capacity on the ADALYs methodology. We hope that you've enjoyed it. Please feel free to contact us for any further information that you require.